Hello everyone, a very good evening. So we are continuing with the Farre series. Yesterday we discussed two important topics in neonatology, that was NRP and birth asphyxia, neonatal resuscitation protocol and birth asphyxia. Today we are going to discuss yet another important topic. This topic has an overlap with biochemistry, but nutrition per se is very important as far as pediatrics is concerned, especially in a country like India, right? Nutrition is very important. If you go into a government health setup, you will find a lot of malnourished children, a lot of vitamin deficiency here and there, and even in affluent areas, because of restrictive diets, these vitamin deficiencies are very common. So we are going to discuss vitamins and micronutrients today and their implications and the scenarios that we see in daily practice. बिल्कुल हिंदी में भी बताएंगे. I don't think I use some fancy words. I use fancy words in English. बहुत simple English बोलती हूँ मैं, और हिंदी में भी बता देंगे. If most of the students are comfortable with Hindi, then we can start with Hindi. I have no issue. You want Hindi or English? Please write down in the comment section. If Hindi, we can go. हम पूरा session हिंदी में ले सकते हैं. अगर English चाहिए तो English में भी ले सकते हैं. Whatever you are comfortable with. Hello everyone. Good evening. Good evening. Okay, we are going to use English predominantly and Hindi here and there. English. Predominantly English. Okay. Okay, so let's start. We are starting with vitamins and micronutrients. So what do you know about vitamins? What do you know about vitamins? You definitely know that we have two types of vitamin. We have fat soluble vitamins and we have water soluble vitamins, right? We have fat soluble vitamins and water soluble vitamins. So what are the fat soluble vitamins? Can anyone tell me what are the fat soluble vitamins? We have vitamin A, D, E, K. All of these are fat soluble vitamins. So vitamin A, D, E, K, all of these are fat soluble. And what about water soluble? Water soluble includes B complex and vitamin C. B complex and vitamin C. Right? So one by one we are going to discuss about each of these vitamins and what are the diseases caused by their deficiencies. Vitamin B complex first. Water soluble. Right? We have lot of B complex vitamins. Firstly, let's start with B1. Can you tell me what is the name of B1? What is the other name of B1? What is B1? Good evening, Mr. Dash. What is B1? What is the name of the B1? B1 is nothing but thiamine. Thiamine, remember thiamine. Right? Thiamine. And what we see with the deficiency of thiamine? Which disease do we see if thiamine is deficient? It is, yes. Can anyone tell me which disease is deficient? Yes, it's beriberi. Beriberi is the disease, beriberi. We have two types of beriberi. We have wet beriberi and dry beriberi. In wet beriberi, which tissue is affected? It is the cardiac tissue that is affected. Cardiac involvement is there. And in dry, nerves are affected. Interestingly, the people who are alcoholics, in alcoholics, this thiamine deficiency is seen. So a name, an entity is given to that deficiency, that is Wernicke-Korsakoff syndrome. Wernicke-Korsakoff syndrome. This you see in alcoholics. And what are the constellation of symptoms that you see over here? You can easily remember that by the mnemonic Goa. Goa. In Goa, alcohol is quite cheap and you appreciate alcohol more in that Goa environment. So remember, alcoholics, Wernicke-Korsakoff, and the mnemonic to remember the constellation of symptoms over here are Goa. G stands for global confusion. O is ophthalmoplegia. And A is ataxia, right? Wernicke-Korsakoff syndrome. Yes, Altaf Hussain, mammillary bodies are affected over here. You see that mammillary light up in the imaging, right? So this is all about B1 and the B1 deficiency, thiamine deficiency. Now let's move to the second B complex vitamin, B2. What is the name of B2? B2's name is riboflavin. Riboflavin. So in riboflavin deficiency, what do you see? In riboflavin deficiency, what do you see? Our ribo gives me red, right? So here you see neovascularization, budding vessels, neovascularization. So here you see neovascularization of cornea. You see neovascularization of cornea. Neovascularization of cornea. Apart from that, glossitis, cheilitis, and magenta colored tongue. Magenta colored tongue. Images was there, but it is breaking down due to some issue. Okay, so we can take the imaging later, or I can have that. Okay, so let us take the imaging later on. Right now, a new vascularization of cornea, glossitis, cheilitis, and magenta colored tongue. After B2, let's talk about B3. What is the name of B3? What is the name of B3? B3 is nothing but a very important niacin. And we all know niacin deficiency causes which deadly disease? It is pellagra, right? So in niacin deficiency, you see pellagra. You see pellagra. Pellagra is also known as 3D disease. 3D disease. 3D disease. Why do we call this 3D disease? Because we see 3 Ds over here. What are these 3 Ds? Diarrhea, dermatitis, and dementia. And sometimes a fourth D is also mentioned. That is death. And here you see a very typical rash. The image we will see in the end. You see the typical rash, a very typical rash. What is that typical rash that we see in the photosensitive area? Casals necklace, right? Casals necklace. So here a very typical Casals necklace is seen. We will discuss a lot more about this niacin deficiency because niacin deficiency pellagra is again a question for your exams as well as a spotter in your viva. Okay, so after B3, let's talk about the next B complex vitamin, which is B5. There's nothing such as B4, we have B5. What is the name of B5? The name of B5 is pantothenic acid. Pantothenic acid. And what do you see when there is deficiency of this pantothenic acid? Remember pant that you wear every day. How do you wear pant? You wear the pant through your foot. So pantothenic deficiency causes burning foot syndrome. This is just a mnemonic, right? No logic behind it, just a mnemonic for us to remember. So pantothenic acid deficiency will cause burning foot syndrome. A very painful condition. You have very painful feet. This is known as nutritional melalgia. Nutritional melalgia. After B5, let's talk about B6. What is B6? Pyridoxine. Pyridoxine. And what do you see when there is deficiency of pyridoxine? A very important thing. Neonatal seizures. Neonatal seizures. Remember in the neonatal age group, When everything fails, your regular anticonvulsants are not working, it could be a rare condition when there is pyridoxine deficiency, and that causes neonatal seizures. Apart from that, you also see anemia in cases of pyridoxine deficiency. After B6, let's talk about B7. B7 is biotin. And if you are hair care, skincare enthusiast, you must have encountered this biotin here and there, right? You must have seen Instagram ads, biotin capsules, biotin gummies for hair, for skin, for nails. So this biotin is thought to help in that hair care and skin care, right? So this biotin deficiency will cause again alopecia, your dermatitis. So what do you see over here? If B7 is deficient, you see alopecia, you see dermatitis. Apart from that, there could be muscular pain, hallucinations. So this is all what you see in biotin deficiency. After B7, let's talk about B9. B9 is folate. And we all know, why do we supplement folate in pregnant females? Because if there is deficiency of folate in pregnancy, it can cause neural tube defects in the baby, right? So folate deficiency can cause neural tube defects, and also we know folate deficiency can cause megaloblastic anemias. Megaloblastic anemias. After that, we have the last B complex vitamin, that is B12. The name we all know, it's cobalamin. And we all know this B12 is notoriously known to cause, deficiency is notoriously known to cause megaloblastic anemia. Megaloblastic anemia. Apart from that, you see SACD. What is SACD? Subacute combined degeneration. Subacute combined degeneration. What else can you see over here? Dementia is also one of the symptoms of B12 deficiency. So if you are someone who is on predominantly vegetarian diet, in a predominantly vegetarian diet, B12 is negligible. So there are very high chances that these vegetarians can have B12 deficiencies, and as a result of that, they can have this megaloblastic anemia, dementias. And if you are someone who is preparing for these competitive exams like NEET PG, INICT, and if you are someone who is vegetarian, please go get your vitamin B12 levels checked, because B12 deficiency sometimes can also cause anxiety, undue anxiety, depression. So it's very important that you have B12 included in your diet. Mental health and B12 levels are very strongly correlated. If your B12 is low, your mental health definitely can be low. So have if you're a non-vegetarian, have more and more of include more and more of animal protein in your diet. And if you are a vegetarian, go for these B12 capsules, or you can have your regular multivitamin that can have a good impact on your health. So after B12, we have completed this all B complex vitamins. Let's move to the next water soluble vitamin, that is vitamin C. We all know what is the name of vitamin C, ascorbic acid. And the deficiency of this ascorbic acid, vitamin C, causes scurvy. And you all know the features of scurvy: bleeding gums, you know the typical X-ray picture, you know everything about scurvy, right? So after this broad overview, I told you that we will discuss niacin in detail, because this can be a very short note in your exam. So niacin deficiency. Niacin, B3, we all know niacin deficiency causes pellagra. Apart from that, there are certain conditions where you can see niacin deficiency. So what all scenarios the examiners can twist? So we all know niacin is formed in our body by tryptophan. Niacin is formed in our body by tryptophan. This tryptophan undergoes various pathways to form different things. It undergoes kynurenine pathway. It undergoes through kynurenine pathway and forms niacin. And it undergoes serotonin pathway to form serotonin, right? If due to some condition tryptophan is not absorbed in my body, what will happen? Niacin deficiency will happen. if due to some reason my body is producing excess of serotonin, then entire tryptophan will be consumed over here. So again, niacin deficiency would be there. Third, this kynurenine pathway, B6 is very important. Pyridoxine is an important cofactor here in this pathway. So if there is B6 deficiency, what will happen? This kynurenine pathway and niacin production will decrease. So these three conditions, you will see niacin deficiency and pellagra-like symptoms. Okay, so three conditions we have discussed. First, where there is problem in tryptophan absorption. So if tryptophan is less, niacin would be less. Second, excess of serotonin. If my body is producing excess of serotonin, my tryptophan will be consumed in the production of serotonin. Niacin won't be formed and I will have niacin deficiency. And third is pyridoxine deficiency. That because of pyridoxine deficiency, this kynurenine pathway is underactive, and because of that niacin production is decreased. So let us discuss all of these scenarios. First is Hartnupp's disease. What happens in Hartnupp's disease? There is decreased absorption of tryptophan. So if tryptophan is less, niacin would be less. So remember, in Hartnupp's, there is decreased absorption of tryptophan. What about carcinoid? In carcinoid syndrome, we all know there is excess serotonin. So because of that excess serotonin production, niacin production is decreased. Then we have B6 deficiency, and because of that, my kynurenine pathway will be defective. And then comes an important pointer that can be asked in your Viva table. Maize or jowar diet. So they will give you a scenario that a child is on predominantly maize or jowar diet. They can also tell that it is a child living in Punjab where makke di roti is very famous, right? What is makka? Makka is nothing but maize. So if there is a predominant maize diet, maize-based diet or jowar-based diet, this maize and jowar, they have very high leucine content. And this high leucine content again affects my kynurenine pathway. So remember, they have high leucine content, and because of that my kynurenine pathway is affected. And if kynurenine pathway is affected, niacin production will decrease. Again, this child is going to have niacin deficiency. Okay, so this was all about niacin deficiency. We discussed in detail what could all be the causes of niacin deficiency. Now another important point for your Viva, raw eggs. Like predominantly maize diet, if they give that the child is eating raw eggs daily, then what vitamin would be deficient? Remember, these raw eggs have avidin in them, and this avidin binds to B7, and prevents its absorption. So which vitamin deficiency would be there? B7 deficiency would be there. What is B7? Biotin, right? So this is all about the water soluble vitamins, their implications, and what all clinical scenario that your examiner can throw up to you in Viva. Okay, so a brief overview about assays and tests. I know this part is predominantly a BChem part, but biochemistry part, but they can ask you in the exam, and if you are writing about a particular deficiency, then definitely in investigations you have to write this assay and test. So one by one, let's discuss. I have made this table so that it's easier for you to remember each one of them. Instead of telling each test along with that vitamin, I have made a separate table so that it's easier to mug up, right? So firstly, let's talk about B1, thiamine. Remember, so what assay, what test do? We check for RBC's transketolase, levels. We're not going into the details and the pathway, that all is biochemistry aspect. We are going to discuss the core pediatrics and investigations that you're going to throw up. So RBC transketolase for B1. Now let's talk about B2, riboflavin. Here we do go for RBC glutathione reductase. RBC glutathione reductase. Then we have B6 pyridoxine. Here we check for RBC transaminase levels. B9 folate, you all know this, you have studied in path also. What do? We check for Figlu excretion, that is histidine load test. Figlu excretion, that is histidine load test. Lastly, we have B12 cobalamin. Here we check for serum methyl malonate levels. Methyl malonate levels. Okay, so this is all about the assays and tests. So with that, we cover our water-soluble vitamins. Now let's move to the fat-soluble vitamins. So in water-soluble vitamins, remember we discussed just the vitamin, what are these vitamins and what their deficiency causes. But in cases of fat-soluble vitamins, these are fat-soluble. So that means if there is excess intake of such vitamins, that would be stored, and I can also have toxicity. In cases of water soluble, they will be easily excreted out through urine. But fat soluble ones, toxicity can also be problematic. So in cases of fat soluble vitamins, along with the deficiencies, we will also cover the toxicity of such vitamins. So with that, let's start with vitamin A. First fat soluble vitamin, vitamin A. So when we talk about vitamin A, we have three active forms. In chemistry, remember, we used to study alcohol, aldehyde, acid. Here also we have alcohol, aldehyde, acid. What is alcohol? Retinol. Retinol. Alcohol. What is aldehyde? Retinal. And what is acid? Retinoic acid. Retinoic acid. Which one out of these is involved in the vision? Which one is involved in the vision? Yes, retinal is involved in the vision. Retinal is involved in the vision. The deficiency of vitamin A, you all know what that causes. That causes night blindness. Night blindness. And what about the toxicity? If my body has excess of vitamin A, that will affect my lysosomes. That affects the lysosomes. Can cause pseudotumor cerebri. That is transient increase in the intracranial pressure. It can cause exfoliative dermatitis. And it can cause chronic fractures too. Chronic fractures too. So this is about vitamin A. Now let's move to the next, vitamin D. What is the active form of vitamin D? You all know what is the active form? 125 DHCC. That is 125 deoxyhydrocholacalciferol. Right? So 125 DHCC is the active form. And we all know what disease you see when there is vitamin D deficiency. If there is vitamin D deficiency in the growing bones in children, that causes rickets. And if we are deficient in vitamin D, what will happen? In grown bones and adult bones, that causes osteomalacia. So remember, vitamin D deficiency in growing bones causes rickets. In adult bones and grown bones, it causes osteomalacia. So what is the deficiency causing? It causes rickets and osteomalacia. And if there is excess of this vitamin D, what will happen? There will be excess of calcium in my body. So that will lead to calcinosis. Calcinosis. So toxicity causes calcinosis. After vitamin D, let's talk about vitamin E. Again, for the skincare enthusiasts who are popping these vitamin E capsules, vitamin E is also again good for the skin. So alpha tocopherol here is the active form. And what will happen if there is deficiency of this vitamin E? Vitamin E deficiency causes three things. First, in blood, it will cause hemolytic anemia. Then for the nerves, it will cause axonal degeneration and spinocerebellar ataxia. Spinocerebellar ataxia. And what about the excess? If there is excess of vitamin E, that can cause low platelet count, thrombocytopenia. Thrombocytopenia. Lastly, we have vitamin K with us. What is the active form of vitamin K? Vitamin K has three forms, K1, K2, K3. So we have phylloquinone, menadione and menaquinone. Right? And this vitamin K we give to each and every neonate. Why? Because breast milk is deficient in vitamin K, and vitamin K deficiency can cause bleeding. Vitamin K is very important for carboxylation of some certain clotting factors. And if vitamin K is deficient, my coagulation pathway would be affected, leading to bleeding. So the condition that we see in newborns is HDN, hemorrhagic disease of newborn, that is due to vitamin D deficiency, vitamin K deficiency. So there you see bleeding. And what about excess? If there is vitamin K excess, it can again lead to hemolysis. And because of this hemolysis, you can see high levels of bilirubin, and such high levels of bilirubin in neonate can cause kernicterus. Right, so this was a brief overview about the fat soluble vitamins. Now let's go into the details, because in exam they are going to focus on each and every vitamin. So they can ask you about a short note on vitamin A deficiency, a short note on vitamin D deficiency. So primarily here we will focus about vitamin A deficiency, because vitamin A deficiency is very commonly asked. Night blindness, what is the WHO staging, everything. Right, so we will discuss in detail about this night blindness or vitamin A deficiency. So firstly, vitamin A deficiency, what are the functions of this vitamin A? This vitamin A is very important for us. It has different roles in our body. The first role is that it is important for epithelial integrity. Epithelial integrity. Right. Second, it is important in vision. We all know retinal vision. Then it is also important in immunity, important in cell-mediated immunity. And it also has an antioxidant function. So if vitamin A is deficient, all of these functions would be affected, and we see symptoms very similar to that only. Very similar to that only. So let's see what all we see. Epithelial integrity differentiation is an important function. So if vitamin A is deficient, this epithelial integrity will be lost or affected. So what you will see in the skin? You will see a very dry skin. This is known as toad-like skin, dry skin. And the term, medical term given to this dry toad-like skin is phrinoderma. So we have dry or toad-like skin, that is phrinoderma. Phrinoderma. In eye, we all know we see night blindness. They ask what is the first symptom that you see in eye and what is the first sign. Symptom, you all know that the patient will tell you that I feel this. What is sign? That we pick up on examination. So what is the first symptom? The first symptom is night blindness. And the first sign is corneal cirrhosis. Corneal cirrhosis, that is drying of the cornea, corneal cirrhosis. Then comes this WHO classification that they ask. WHO classification, we have X1, X2, X3, XF and S. So X1 firstly is divided into A and B. In X1A, you see the first sign. What was the first sign? Sorry, I have written corneal. First sign is conjunctival cirrhosis. Drying of the conjunctiva, conjunctival cirrhosis. B stands for Bitot spot. What is Bitot spot? Can you see this image? Can you see this epithelial plug over here on the conjunctiva? This is nothing but Bitot spot that you see in vitamin A deficiency. After conjunctival cirrhosis, conjunctival dryness, there will be corneal dryness. So we have corneal cirrhosis. And after X2, there will be ulceration over the cornea. Corneal ulceration. If this corneal ulceration covers less than one third of the surface area, then this is X3A. If it covers more than one third of the surface area of the cornea, it is X3B. In XF, you see fundal changes, and XS is scarring. Right, corneal scarring. So this is about the WHO classification. What would be the treatment of vitamin A deficiency? Definitely we have to supplement vitamin A. How will you supplement? We give oral vitamin A supplementation on days 0, 1 and 14. That means if you encounter a child today, you give 1 dose on that day, ask the mother to repeat the dose tomorrow, and then after 2 weeks from that particular day, you have to give this. So 3 doses. And what would be the dose? If the child is less than 6 months, we give 50,000 international units. If the child is 6 to 12 months, we give 1 lakh international units. After 12 months or 1 year, we give 2 lakh international unit. Now, what is the catch over here? If it is a malnourished child, if the child is above 1 year, but the weight of the child is less than 8 kg, it is a malnourished child, then we don't give 2 lakh international unit. We give half dose. We give half dose. So that means you're going to give 1 lakh IU in that child. Right? So this is all about the dosage of oral vitamin A supplementation. Okay, so this is all about vitamin A deficiency. We have covered broadly the fat-soluble and water-soluble vitamins. So one chunk of our today's class is done. Now micronutrients. Let's talk about micronutrients. In micronutrients, I have two major micronutrients for you, zinc and selenium, which is asked in your exam. Firstly, let's talk about zinc. This type of patient or scenario would also be asked in your Viva exam and can also be asked as a short note in your theory paper. So what can you see over here? Can you see a typical rashes over the face, perioral, and over the potty area also, perianal, excoriation, dermatitis like picture. So what is this? This is zinc deficiency. And this zinc deficiency that the examiner is fond of asking is acrodermatitis enteropathica. Acrodermatitis enteropathica. Enteropathica. What happens in this condition? This is an autosomal recessive condition. What happens in this condition? The transporter in our gut that is responsible for absorption of zinc, that transporter is defective, and because of that there is defective absorption of the zinc leading to zinc deficiency. So there is zinc malabsorption because there is mutation in the zinc transporter. The gene that is responsible for that zinc transporter is SLC39A4. 39A4. This gene is mutated, and because of that, my zinc transporter is defective. Right? What do you see over here? The same picture that I showed you. What is this? Dermatitis. So you see dermatitis, perioral and perianal. You see alopecia. And you see diarrheas. So this is the typical triad that you are going to see in zinc deficiency: dermatitis, perioral and perianal, alopecia and diarrhea. Right, so this is all about zinc deficiency. Let's talk about the next micronutrients, that is selenium deficiency. This will basically come as a Viva pointer, single liner, the cards that they give you. So in one of your stations, they can ask you about selenium deficiency. So selenium deficiency, remember, can affect your heart and bones. If heart is affected, that disease is known as Keshan's disease. Keshan's disease or Keshan's cardiomyopathy. And when bones are affected, this is known as Kashin-Beck disease. Here you see osteoarthropathy. Right, so this is all about selenium deficiency. So we have covered vitamins, water-soluble as well as fat-soluble vitamins. In water-soluble vitamins, we discussed about the deficiencies, different deficiencies. We discussed about niacin deficiency in detail and the assays and the tests that you are going to employ. And in micronutrients, we discussed about selenium and zinc. In fat-soluble, we discussed about the deficiencies and the toxicity. Now let's look at some of the images that we were discussing. So the first image, B12. Remember B12? Riboflavin. I told you ribo means red. So what do you see over here? Can you look over here? There is sprouting of vessels into the cornea. This is neovascularization of the cornea that you see in B2 deficiencies, riboflavin deficiency. Apart from that, you see glossitis, ciliitis, right? You can see over here, and magenta colored tongue. What is this? This is the typical photosensitive rash that you see in niacin deficiency. What was this? This is in the light exposed areas, you see this rashes, typical pattern, Casals necklace. Casals necklace. Zinc deficiency treatment would be zinc supplementation only, but in this case, acrodermatitis and enteropathica, the transporter is affected. So we give high doses of zinc. Normally in diarrheas, if the child is less than 6 months of age, we give 10 mg per day for 14 days, and if the child is above 6 months of age, then we give 20 mg per day dose for 14 days, right? So this is Casals necklace. Apart from that, we have seen the images, right? We saw this bite dot spot, we saw this zinc. With that, we end our today's session of vitamins and micronutrients. If there is any doubt regarding the today's content, feel free to drop that in the comment section, and I'll be more than happy to cover that again or take up that topic. If not, we can end the session. Kalyan, weaning is a very big topic per se. We would need a bigger class for that. Definitely, if there is some further class on based on nutritional complementary feeding, then definitely we will take up weaning. Weaning is not related to hair and vitamins and micronutrients. Vitamin will have a more holistic approach. I would have to tell you about balanced diet, carbohydrates, proteins, fats, everything, and how to wean off. We will also talk about breastfeeding, breast milk. So not possible today. Anything related to vitamins and micronutrients that we discussed today, I'll be more than happy to take that up in detail. Any other doubt or any other query? If not, then we can end the session. Okay, so if there's no doubt, then let's wrap up. You can explore Farre series. We are right now doing the 4th prof subjects. Farre is for each and every prof exam. So download the MedEd app and explore this Farre section. And I am pretty sure that this would be very beneficial for your prof exam, and not just prof exam, your NEET PG INI exam, the topics stay the same, right? In the prof exam, just you know how to write down. So advice from my side would be that whatever notes that I have made, try to write that down and try to make sentences, try to make notes out of it, so that when you are writing in the exam hall, that's a muscle memory. You don't need to think and then form sentences. You have the muscle memory right there. An examiner just wants notes like this only, the pattern that I have shown you. They want clear-cut flow charts, clear-cut tables. They don't want, and they don't expect paragraphs out of you, right? So this is just the core idea behind Farre series, that we give you an idea of how to write an exams. Okay, so that's all. Thank you for being patient throughout the session. I hope this helps you in your exam. Vitamins and micronutrients is a very favorite topic. And in fact, in your table vivas, they are very fond of asking about these vitamin deficiencies. And nutrition is a very big topic. And nutrition is, in fact, a very important topic in pediatrics. In nutrition table, you're going to have different dals, rice, and everything. You have to mark up the calories a day before so that you can just vomit out on the table. And apart from that, a lot of questions on these deficiencies can be asked. In fact, they can give you x-rays and ask you about vitamin D deficiency. So Uday Singh has written out each and every vitamin that we have discussed. We have discussed each and everything in detail. Vitamin A especially, B complex also. Okay, so thank you for this session. We'll meet next week with yet another topic for your exam.